So good morning, everyone. Happy middle of July. We've made it this far. We are so thrilled that you are able to join us for our town hall featuring Joanne MacInnis, my colleague, the owner of Aberdeen Home Care, Joanne MacInnis RN. If you were at our information session back in March there at the Wenham Council on Aging, then you know it was right as the COVID-19 pandemic was beginning, and everyone had questions, including us, and we still have questions. But our mission today is to try to answer a lot of questions that have come since all this thing started, and to sort of let you know where we can be going next. I mean, we're hearing everything from hydroxy, chlora, whatever it is, to remdesivir now. And it seems like one works and one doesn't work at all. In fact, one is very dangerous. So we're going to get a lot of questions answered today. We're going to invite you to ask a lot of questions. If you're not comfortable just raising your hand so that Joanne can answer a question for you live, put it in the chat function down below. Does everyone know where that chat is? If you move your cursor, you can see the chat down below. You can add your question there and we can answer them either at the end or as we go along. So without further ado, unless anyone has questions or anything else they'd like to add before we go, I will introduce our actual host for today's event. That's Joanne MacInnis RN from Aberdeen Home Care.
Hi, everybody. We had such a great meeting over at the center, and that was just a few days before our office actually closed for 4 months. Who knew that it was going to close down so quickly? And we talked about emergency preparedness at that time. We talked about getting your papers in order. We had a folder that you were going to put your emergency documents in, and we went through all of that. Couldn't have come at a better time. I was actually listening to NPR, as I do almost every day, and there was a physician on just 2 days ago, Wednesday, talking about the importance of having these documents in place now more than ever, and having conversations with your family about how you want life to be. One of those big questions that has been coming up is, I never want to be placed in any kind of facility. Well, what we're seeing now in home care is that nobody wants to go to short-term rehab at all. Scott, I'm getting a lot of feedback from somebody. Could you mute everybody but me? And then
I'll do that. Yep.
People want questions. It might just be a background noise. And so now what's happening to people in hospitals are that people, let's say a hip replacement or a knee replacement or another orthopedic surgery, no one wants to go to rehab, which used to be standard practice. So everybody that's in the hospital wants to come home. People are dying to get their loved ones out of long-term care facilities, AKA nursing homes, and now nobody wants to go there. So the surge for home care has exploded. We've always known home is the best place to be in most situations, but now everybody seems to be catching on to that, because congregate living, whether it's a soldier's home or a veteran's home or anything else, has inherent dangers with it. Not to say that there aren't dangers everywhere. You know, you put your feet on the floor and you've accepted your first danger of the day, your first risk of the day. And these are calculated risks that we all take. But as far as people being ill and needing care, what we're going to see, the trajectory is, and it's all over the industry, this isn't just my prediction, is that we're going to see vast growth in people choosing to receive care at home rather than going to rehab after surgery or to receive care as their health situation might decline. So what is that doing to the industry? Well, it's causing us to be needing to be responsive and to maybe make alliances with other companies that are like-minded so that we can share staff, or we can have an ability to scale up or scale down as the case may be. Aberdeen has hired, I think, 12 full-time people since the COVID started. We have a very rigorous onboarding and hiring process. So our hiring versus someone else's hiring is a different ballgame. People are maybe in the office for 4 or 5 hours before we offer them a job. They take an exam, we go through all of their backgrounds and all of that. So it's a burdensome but necessary process in order for us to get the people that we want. What does it mean for consumers? I think that consumers have to be pickier than ever, because some agencies, and I'm not criticizing them, this is their model and they're welcome to it, are onboarding people through Zoom and online as quickly as they can. And they're perhaps not as discriminating as we are. So asking a lot of questions. If you or people you know are in the market to hire private duty home care, it's a time to get your list of questions ready, and they should be tough questions, and put it to them about credentialing and how do we know this is the right person to take care of me? On to COVID. You know, you're all like me watching the news and you're scratching your head and you're thinking, if containing this is so easy by social distancing and wearing masks, why are places falling apart? It's not just the numbers. Numbers, they can be alarming. You know, if you say Montana has 200% more cases than they did last week. Well, if they had one case last week, you know, and they have 200 cases this week, that seems very dramatic. If they had 10,000 cases last week and they have 200,000 cases this week, of course, that's very different. So as we look at what's happening in other parts of the country, it's really not a big mystery how it happened. It happened because they didn't do what Massachusetts did. They didn't do what we did. They didn't take the stay-at-home order seriously. And when things lifted and they went out into the world, they went out, in my opinion, with reckless abandon. And they did not use the tried and true, scientifically proven methods to reduce exposure by very simply wearing your mask. And not like this. I'm showing you a profile of my little nose. That does us no good. You know, I have two things to share about wearing masks like this. So this is our stand-up comedy portion of the town hall. So there was something that went around on Facebook, and it showed like a 14-month-old boy toddling around in his diaper, but his urinary unit was over the top of the diaper. And the caption said, "Wearing your mask under your nose gives you as much protection as this pamper does to this little boy." And then he promptly, you know, peed right outside the diaper. So very clear on that. The other one hit the women, and it was a cartoon of an elder woman with, in the medical field, what we say is an ample pendulous breast. Okay, so that gives you a great visual. And she said, "I wear my bra for your comfort, not my own. I hope you appreciate it." And then she said, "Wear your mask." Oh, she said, "My bra is not very comfortable and neither is the mask, but I wear it for your protection," which is so funny, you know, and so clever. But it gets the message across. It's not all about us. And everyone on this call knows that. And I know, because I've had the opportunity to sit with you and talk with you, that this is how you're living your life now. You wouldn't go out without the protection of a mask because it's too risky. So we'll definitely open this up to questions and discussion, and I want to hear how you're coping and what you're thinking. But even though Massachusetts is enjoying really the lowest numbers in the country for people, we were an epicenter, and we're way, way down, totally manageable. There are ICUs now that either don't have COVID patients or have very few. As you look at Florida and Texas and Arizona, they are saying, I saw on the news last night, our ICUs are full. We now have to open other facilities and turn those into ICUs like we did. We had the Hope Recovery Center at the Bayside Expo, and we had the Worcester Centrum. Those were both converted into hospitals. That's what they need to do now. And then you have to get the ventilators and all of that. So it's interesting, though, what we know about COVID now is legions ahead of where we were in March. We didn't understand how COVID was killing people, and now we do. We know this virus is so attuned and skilled to go after certain organs. It goes after blood vessels and causes clots. And so what they found is on post-mortem exams and even MRIs and CAT scans on living patients, their bodies are filled with blood clots. And so it's interfering with the clotting mechanism, the liver, the vessels themselves. There are receptors in the brain, the kidneys, and the lung that seem particularly able to take on, you know, we've seen the virus and it's got all the red spokes sticking out. Think of those spokes like keys, and that virus molecule gets into your body, and that little spike is a key, and it goes directly into the cells of some of these specialized places in the body, which are essential for life. So we know a lot more about it, but still so much we don't know about it, which brings us into the discussion of antibody immunity and vaccination. And they've recently been doing studies on COVID positive patients that have recovered, and they're measuring their antibody levels. And the good news is that post-infection, your antibody level is high, but then it tanks. So they're testing people every 2 weeks after they have recovered from COVID. And sadly, what they're finding is that the antibody level is less and less the further you get away from active infection. So how does this translate to the vaccination process, which is trying to mimic the body's natural process of developing antibodies. Well, that's thrown a huge monkey wrench into the vaccination process. In Massachusetts, again, we're so fortunate. The company based in Cambridge called Moderna is linked up with MIT and Mass General, and the National Institutes of Health, and they have a vaccination that's ready to go to 30,000 participants in their live test. I think they've tested 30 people so far. So what they do is they give them the immunization, and then like every day, pretty much they're drawing blood, and they're giving people a full-on medical exam to see if there's any side effects and measuring when do the antibodies start being produced and how long do they last. So you can't throw this vaccination out into the world until it's very well tested. I wish I had the statistics, and I think I'll look them up, on the smallpox and polio vaccinations. Those are the ones that are really in our minds, right? And we think about how long did it take to really perfect those so that people didn't get sick. Back in the day, they used to use live virus. Right now, we're so sophisticated, we take the genome, we take the DNA and RNA, so it's not a live virus. It's genetic material from the virus so that you don't get the actual virus from the vaccination. Back in the day, they used to take a little bit of polio and give you a little bit of polio and give you a little bit of smallpox so that your body could create its own natural immunity. So it's an unbearably complex process, but we're so fortunate this is happening in our backyard and that we have access to such information. This could be a 5-hour town hall, but it's not. So I'm going to open it up after my opening remarks and see what your thoughts are, what you're worried about, how you're finding, the unveiling of the stay at home as things open up, how vulnerable you feel, what questions you have about masks and protection. So Scott, if you want to unmute people, and Dawn and Beth, I can't see you, but if you want to just throw your name in the chat, if you have something to say, or just speak up. We'll get to everybody because it's such a small group. We got 5 participants plus Scott, myself, and Jim. So we should have plenty of time to get to everything.
Well, I have questions about the antibody test. Is it available if people just want to go get an antibody test, or can you only have it if you know you were actually positive?
They are really tight with the antibody tests because they call it the curiosity factor. And so people are wondering, yeah, I felt sick like the end of January. I wonder if that was COVID. There are so many people in that category. They're worried. I think this is the big worry about not doing an on-demand antibody test. Let's say that you went, Jean, and you found that you had antibodies, but you weren't you. Let's say that you were sort of a cocky, 20-year-old who was immune from everything in life, and you had antibodies, and so the heck with it, you're going everywhere without your mask now. It could give people a real false sense of security, and then we end up with more problems than we started with. Also, because the antibodies themselves are unreliable as far as how long they live. At any moment in time, maybe if you went to get the test, you would have a really strong antibody presence. Maybe in a month, you'd have no antibody presence. So not enough is known yet about the length of the antibodies serum, which means in the bloodstream. And so it might give you a false sense of security.
That's interesting. Now, I think there was a town hall on CNN last night, maybe, and Sanjay Gupta said another possibility is that the body may have learned how to make the antibodies. Have you heard about that, or what do you think?
Well, the body has learned, because people who have had COVID have antibodies. So the body has learned how to do it. We don't know if those are people. See, here's the misnomer. If you've been exposed to COVID, you can consider yourself infected. There's been this discussion about I was exposed versus I was infected. Well, I guess that's not entirely true. If you were exposed but had a negative test and you never got the active disease, you won't be getting antibodies. The only way that you get antibodies is to have been infected. That's the only way it works. It's just like the vaccination. You're not going to get antibodies. If Scott was antibody protected and I wasn't, rubbing elbows with him is not going to get me protection. I have to have that illness in my own body for me to produce the antibodies. But how long they last is the big question.
Yeah.
Well, yeah, we're opening town hall next Monday, and I talk to directors of other councils on aging every week. One's an Essex County group, so a little bit broader reach. Also one from Melrose that was organized by the director in Melrose, as well as Senior Care's collection. And yeah, I mean, a lot of people have been closed. I've come into my office every day, but I guess cutting to the quick, we've been kind of, in light of the fact that town hall is opening, as you know, we've got all kinds of plexiglass up in front of the windows of all the various offices and so forth. But then you've got, people themselves who are working together coming in, and then I don't know. I just, as my wife being a teacher and talking about going forward with school this year, I just wonder what the right mix of information to be putting out there is. I mean, we obviously have the 6 feet and the wear the masks and wash your hands frequently, but I was wondering what your thoughts were as far as as we open up and where we're headed from here.
So at Aberdeen, we opened officially a couple weeks ago. We have a station before anybody walks in, and we have documents that need to be filled out. And I'm happy to share our document with you, Jim, if you wanted to reproduce that. And it's 5 questions, and it's no longer temperature. Everybody was so focused on temperature. There are many people who had a 99-degree temperature, which is not even a fever, and they were badly infected with COVID. So the whole fever thing is really is dying down. Now we're seeing a lot more GI complaints. We're seeing people that have, diarrhea for 3 and 4 months, that become dehydrated, can't eat, tremendous abdominal pain. And then with the children, we're seeing this, Kawasaki-like syndrome, where their limbs turn blue and they end up clotting off in their extremities. So the whole notion of if you're afebrile, which means without a fever, that's less and less important. Thinking about the symptoms that you may have or exposure to people who may not have social distance is part of our questionnaire. So we have people fill out the questionnaire, we have them sanitize their hands, and we make sure that they're wearing an appropriate mask. It's not, what happened in the beginning is we all were so afraid of everyone else. We thought like just walking by someone on the sidewalk made us vulnerable. And maybe that was just part of how we took the information in and made it our own and figured out how we were going to live. We're not at that much risk. We're at risk when we don't use the very simple safety measures. I call it the 3 W's, and then I always put my W up. Wear your mask, wash your hands, and watch where you go. So if you're only going to Crosby's, or you're only going to the senior center, or you're only going to CVS, and you're washing and you're not touching everything in the store, and you keep your mask, not the little boy way in the diaper, but appropriately covering nose and mouth, you're protecting yourself and others. So the risk isn't just being in the same room with someone. And remember in the beginning, we're scrubbing our groceries with bleach and all that. I had gloves on at the gas station, and I've got Saran wrap on my hand as I'm putting in my PIN code for my debit card. As long as we have hand sanitizer in the car, we're washing our hands when we get done. Remember how few incidents of healthcare professionals have come down with this disease. Very few people. When you think of the million or more healthcare workers there are, and there have only been 538 deaths among the healthcare community in the United States that have died from COVID. There have been higher incidents, and maybe those were people, this isn't measuring ICU and hospitals, this is measuring nursing homes and rehabs and soldiers' homes, everything else where there was no personal protective equipment. There were no masks. They didn't isolate people, sick people from healthy people. It was very poorly done in the beginning. And so I'm guessing a lot of those infections happened because the patients weren't protected and the staff wasn't protected. Now we know how to protect ourselves. So I think our anxiety and our fear can come down a bit. If we employ sanitization in the center, we have the sanitization bottles. If every hour people are washing the tops of the tables, the sides of the chairs, the common area where you have coffee, maybe people bring their own coffee for right now if people feel worried about that. There are definitely ways to stay safe. We have 9 people in our office, and we have 1 person in an office because, it's pretty tough to go through your whole day of work like this. So we're separated. Scott's upstairs in our kitchen, and, we have people spread out all over our building. But you can do that too. You can have 2 people at a table, or you can set up your room differently.
Do you have one-way kind of entry
Yes,
in and
we
out,
enter
or
through one door, yes.
and go out
then-
the other?
Yes.
Yeah.
So we
Yeah,
people, we sort of move the traffic around.
Yeah.
But even talking to each other, you remember 6 feet is without a mask. So the guidelines from the Center for Disease Control say, if we're talking to each other, we're better off outdoors and 6 feet apart without a mask. If you have a mask on, if we're both wearing a good mask, then this is the KN95. So this is reducing 95% of what comes out of my breath and what comes at me from you. And remember, it's passed much more effectively through the droplets. Pretend I'm breathing in glitter, and when I breathe out the glitter, that's where it's coming from, not so much the surface.
So my bocce people are going to be very happy to hear that they wouldn't have to wear a mask if they remain 6 feet apart. In light of what you just said, if you're better off 6 feet apart outside without a mask.
Well, you're better off 6 feet apart outside with a mask. But
Okay.
if you, but it is not acceptable to be indoors any closer than that without a mask. Even Aberdeen, we are indoors with masks. If we're passing each other in the hallway, if we're interacting at all, everyone's wearing a mask. And it's important to think about what kind of mask you're wearing. So I have a variety of masks, like you all probably do. So this is the N95. This is the big gun. This is the one that's the NIOSH approved. It's got the information right on it there that it's NIOSH approved, and and then this is the KN95. If I'm talking to people that I don't think have COVID, then I don't need to wear the big gun mask. I also have, I have a variety of these, which you probably do too. These are cotton masks. This is a 2-ply cotton mask. And this is, you need to know, this is about 50 or 60% effective. This is a lot easier to breathe through. So keep in mind, if you're wearing a paper mask, like Scott has a paper mask on, that mask is easy to breathe through. That is not as constricting as my KN95. That's easier to keep on all day. However, there's no free lunch. That's giving him a lot less protection. That's giving him less protection, and it's giving you less protection. So it's important to do some mask education with people. You might want to just print out some stuff and leave it at the center about the different kinds of masks, paper like Scott's wearing, double-ply cotton. There are some of these cotton masks that have a slice here, and you can put a filter in. And HEPA, you know what's really effective? HEPA vacuum bags. That's what people have been cutting up and putting in these masks. It does make it a little more difficult to breathe. Why? Because it's offering you more protection. The true N95 masks are very hard to breathe in. God bless those medical workers that have those darn things on all day long. So Scott's now wearing his KN95, which will be harder for him to keep on all day, but it's giving him 95% particulate protection, which is much, much better than his paper mask. Barry.
Hi, thank you, Joanne. Jim, I have a question for you having to do with the senior center. Of course, Joanne and Scott, you might actually have some input as well, but my concern is for the ventilation system. Now, in the summer, you keep the windows open, I guess, unless it's a really hot day. Then you have the air conditioner going and so forth. There's just so much you have to think about, Jim. So if random seniors are coming in and they go through the questionnaire, the 5-point questionnaire, everyone who comes in, and they even wear a mask, which I guess that should be a requirement inside because it's such a small place. Joanne, you know the Wenham Senior Center, it's small. Yeah,
I would agree.
So my question is, what about the ventilation system? And that is a reason why, Jim, I love you and I love the senior center, but I'm not going to go inside for anywhere that's public for a long time. So ventilation.
Yeah, so yes, oftentimes if it's like over 75, it's very hot. So we have window air conditioners, and pretty much Kathy and I are the only ones here, and we're not going to follow the lead of the town hall, so we don't plan to open up inside for a while. Because I mean, if a lot of the bigger centers aren't open and haven't been, and we've been open because we're working, and I feel it's important to make calls and to do things that support those people 60 and over. But yeah, but we're not entertaining the idea of having people in. We do have people come in for equipment, and we've set a limit to 4 at any one time. And you know, and everything I hear about things where the senior centers are getting people together is being done outdoors. So like walking, I mean, even a book club could meet outdoors and be safe. So I mean, that's kind of, but at this time, and probably for at least another month, I think we won't have any more than 4 at any one time, and I think I think we're going to keep the door locked. So,
And, you know, think about time limitation. You know, getting together for a half an hour is fine. You know, you don't need to come and park out there for the whole day. And so doing something meaningful, and remember, you have your mask on. Another thing I would encourage you, Jim, is HEPA filtration.
yeah.
And I bought some really good ones. I got them on Amazon, and they're medical grade. And I bought 6 of them. There it is right there. So Scott has it right behind him. And we put that on whenever we have people in any kind of, you know, corporate, I mean, you know, we have 95% protection with what we have on our faces. And then we have the HEPA filtration going full blast. And also windows open helps.
So where do you put the cloth mask in the pantheon of good, bad masks?
The cloth mask is around 50%, but I don't want to be quoted on that. So I would look up, I think if you just Google, you know, mask options / protection or something like that, you'll get a readout of what they're doing. Yeah. What they're offering. That's good to know.
But the HEPA filtration, I've noticed they're doing that like barber shops and salons and anywhere like where you're, that's a really good idea for this space in particular.
Yep. That's what hospitals do inside all of their air circulation. It's all HEPA filtration. Airplanes are supposed to do the same thing. I'm not getting on an airplane.
No.
If I can go back to Barry's question about air conditioning for a moment, there was a great piece on NPR just the other day where a scientist who specializes in particulate matter in the air and air conditioning from somewhere in the Midwest did an excellent piece on central air conditioning versus window air conditioners versus all kinds of air conditioning. It might be worth your while, Barry, to look online and see if you can find that from NPR.
Okay, great.
Took away from that piece was that with central air conditioning in a large building like the town hall, I'm thinking maybe, unless they just have window air conditioners, which some older town halls have, but in a more modern building with central air conditioning, very little air is brought in from outside. It's mostly air from inside that's recirculated because it's hugely expensive to take hot air in and cool that. They use the existing air within the building and just continually circulate that and cool it. So, you know, there's all different kinds of things to consider with what condition the air is in before it's being cooled, and always wearing a mask when you're inside, even if, you know, and staying 6 feet apart. It's obviously the safest and best thing we can do until we really get our arms around this thing. And I have another question actually for Joanne before we move on. And I don't want to take away from anybody else, but just a quick question. Tom Hanks and his wife, Rita Wilson, were one of the first couple celebrities who contracted COVID-19, and they were diagnosed positively with it, and they were, you know, quarantined. But they have since been able to donate plasma, which has been very effective in helping those who are struggling with COVID-19 to recover. And so my question then is, are the antibodies in the plasma? You know, the plasma is the fluid in your body in which your blood travels, you know, within. And so if you can answer that question for folks, I think that might be helpful. What's the plasma treatment all about?
Plasma is part of blood. And if you take blood and you take it to a lab and you spin it down, so you take out the red blood cells, you take out the white blood cells, plasma is the base fluid of blood. And so that is where the stuff lives, the antibodies live. And whether or not they have an antibody count, I have no idea. I have no idea why. I mean, I know a lot of people get transfused, period, because it affects the spleen, it affects bone marrow, where your blood is produced. But I don't have any knowledge of that. It'll be interesting to find out why their plasma, and does their plasma contain any antibodies? That's an interesting point, of which I know nothing. Sorry. The thing about the air conditioning that has me
Janie might know something.
The only reason I know something about plasma is my nephew contracted COVID-19. He got it from, I think, Dubai early on. So he's been followed by the state of Florida, but he has donated his plasma. And he also told us he can specifically donate to a person who asks, to maybe a family member or friend who has COVID-19. And I guess there is a way of counting your antibodies to make sure it would be worthwhile to do that.
Wow,
so
that's amazing.
It is amazing. And there was one other thing I've been learning about the plasma, but I forgot now.
It'll come back to you.
It'll come back to me when I'm not thinking about it. So
the interesting thing about the air conditioning is that if you're taking air, recirculating air like you are in an airplane, and it's going through unless it's going through a filtration process, it's going through a HEPA filter, that's pretty good. That's what a HEPA filter does. That's what that portable HEPA filter does, is it filters the air that's in the room. But if you're in a big building and it's taking air from level 3 and it's putting that air on level 10, that makes me a little nervous. I like the fact that my window unit is sucking in air from the environment, which is large and voluminous and thought to be COVID-free, and that's what I'm breathing instead of somebody in the next level in the building. So that's just an interesting thought.
Mm-hmm.
Harry.
So at this point, I don't think there's enough coverage and enough protocols established, enough knowledge by all of these organizations or towns or whatever that run big buildings, because this information is coming in, as Scott said. It was on NPR, great article, but who listens to that? Well, I mean, I do, but I mean, not everybody has gotten that information yet. So my protocol is I don't have to go to work. I am retired. Congratulate me. So I have avoided, and I intend to avoid, going into any inside venues. I get my groceries delivered, for example. I haven't had any kind of emergency where I have to go into a venue like a doctor's office or, I don't know, something, a toothache, whatever. So I'm going to continue doing that because, frankly, it's my life. I don't trust a big organization to have my life, on its watch. Everybody is going to try to do their best, but it's a broad brushstroke, and it might not cover me. So I am obviously going to be risk averse, and that's just me. By the way, some of my friends support that. Some of them think I'm a little nuts, but I do not care. I have enough life experience to know that I am doing the right thing for myself.
So the only
I don't
thing
feel, yeah.
I want to throw in, Barry, is that
Yeah.
as long as you can control that, that will work.
Yeah, I know.
Something may happen to you that will take away some of that decision making. So
I
let's just say
understand that.
you had a fall and now you're in the ambulance and you're headed to the emergency room because you have been so hyper vigilant about being separate and protecting yourself. The amount of anxiety that could fall upon you could be extreme. So even though you're making this choice, I will encourage you to let it sink into your mind that in an emergency situation, there are ways to stay safe. You are mitigating your risk by taking no risk. And that works until it doesn't. And then when it doesn't, there are ways that people can help you stay safe. People know ever so much more about this now in mid-July than they did in mid-April. And there are containment ways of practicing I have been to the dentist. I have had a crown put on. I've been in the dentist chair 3 times. And the protocols that I see have given me more and more confidence that I can be protected in one of those environments. Remember how much PPE they're wearing. They're wearing the N95 mask. They're wearing a face shield. Their bodies are covered. You know, their hands are covered. You're essentially being cared for by, you know, sort of a non-human. I mean, a human underneath the veil, like a Batman suit. You know what I mean? So the risk in those situations is very low. I just want you to think about that and tell yourself, if I ever had to get medical treatment, I would get it. I wouldn't be so afraid that I wouldn't get it. And this is what's happened to a lot of elders. They've had phenomenal abdominal pain or chest pain or shortness of breath. And they think the medical community is too busy to deal with me because they're taking care of the COVID people. I don't want to get COVID, so I'm not going to the hospital. Then they end up with a very serious medical condition that really started a month ago, and they were too paralyzed with fear to take care of it.
Yeah.
While you can choose away. But if something happens to you, trust me that the medical community is, I mean, they're working there. They're going home to little kids and babies. They know how to stay safe now. And they're not putting themselves at risk unless they knew that they were pretty safe. And so you can trust the medical community if you have to have something done.
And I do want to thank you for that. And I definitely would. I am not so out of my mind that I've become a hermit.
And I didn't mean to
No, I know you didn't. That was an incredibly valuable pep talk for me. So notwithstanding that, you know, I plan to continue to do what if anything is within my control, you know, I will have my own parameters.
It's very interesting to think about how different people experience what makes them feel safe. And that's how we operate in life, whether we know it or not. You know, there are people that don't wear seatbelts and people that do wear seatbelts. There are people that drive great big honking Volvos because they think they're the safest car, and people that drive little convertible MGs. So we're all on that spectrum of how much risk we can tolerate. And under the microscope of COVID, it just blows that up. It really shows, you know, how, you know, what our self-protective mechanisms are going to look like that we've always had, but may have not have been as obvious to other people. But we're all having this, it's sort of a traumatic response to how do we stay safe in a world that feels unsafe. And the differences in how we respond are as different as we are as people. So there's no right or wrong way. Well, there is a wrong way. There is a wrong way. And not wearing a mask and not caring about other people is the wrong way. But for you yourself in your home and taking as much precaution as you feel, you know, led to, you know, don't let anybody shame you for being as vigilant as you are. That's how you feel safe. And you own that. Like you said, this is your life. You own that. And you have every right to it.
Yeah.
So I was surprised, found out that most of my friends are doing the same thing Barry is doing.
Yeah.
I have friends who have not gone to the grocery store since February. And I live alone, so I go, but I go during the senior times. I go early in the morning. I figure there's less virus at 6 a.m., things like that. But people are very, very vigilant. But we are now in this time, as you pointed out, we have very low cases. Is this a time where we can think, like Jim was talking, like think about what we might be able to do and get back a little bit to normal? Or what do you think, both Scott and Joanne? Do you think we should be hunkering down, or should we be testing the waters a little bit? What do you think?
That's a loaded question. So, you know,
Scott, Jim is trying to talk, but he's
I'm sorry, Jim.
I'm sorry. No, I just wanted to say one thing about that, and then I kind of have to go off the call. But you know, the struggle for us has been just isolation. Was a huge problem before the pandemic, and now we're faced with, you know, truly people not feeling well and needing to, you know, resume their lives to find a way in which to reconnect with people. So, like, when it comes to trying to, you know, help with that, I guess, trying to do things outdoors, trying to do things that are safe, trying to just help people by calling, because that's all we've got, in a way. The phone is one way, particularly for people that are what you would categorize as frail elders, in order to stay in touch with them. And it's so important, I think. But otherwise, it's kind of just trying to, connect people somehow. And it's a struggle. It really is. It's because it doesn't feel right in a lot of cases to invite people to things yet. But I think we have to kind of push ahead, push forward, but do it safely. And so that's kind of what we're trying to do. I'm sure that's not entirely helpful, but I'm just trying to. I feel like in order to be relevant, we have to deal with isolation as the issue that it's always been, and the fact that it's worse now. And I'd love to hear Joanne and Scott talk about that to whatever extent they're able to help. That's great.
I think isolation has become the new normal, and it's always been a problem, but now we feel like we have no choice. So we become a little bit apprehensive about people in general. And so finding ways that you can sit in someone's yard with 3 other people and kind of increase your distress tolerance. Like, oh, I feel vulnerable like this, but I'm going to kind of get through it. I'm going to sit here. I can sit 10 feet apart outdoors with a mask on. I remember the first time I had people to my yard, I was really worried about it. Like, I almost canceled it. I thought, I can't do this. I'm not ready for this. I can't do it. And then little by little, wow, look at Jim. Wow, Jim. You're kind of looking pretty buff right there. Wow. Woo. Is he on, what's that? Are you The Bachelor?
That was a long time ago.
It's pretty impressive looking, Jim.
Thank you.
And I want to get to Beth's question before we end, because Beth's going to the dentist and she really wants to hear about that. I had my dental appointment in my dentist is in Hamilton on Railroad Avenue, Dr. Lisa Murray, and I can tell you about my experience going in there 3 times in the last 3 weeks. But detoxing off that, people are so dangerous to me. Well, Joe Q Public is dangerous to you. But somebody who lives in your town who's been observing social distancing just like you, not going out without a mask, not inviting throngs of visitors to their house or people from out of state, they are relatively low risk. And so to get used to being around people and not looking at them as, super spreaders or viral load people, people who have observed the same kind of self-protection that you have, you're fairly safe with them. But you're meeting outdoors and you're wearing your mask and you're staying far apart. So if you have some of those low-key events to kind of ease your way back in, like put your toe in the water and just see how that feels to you. And what is everybody talking about when they get together? They're talking about how this has impacted their lives. It's like when you have babies. Remember having little kids? You'd go out for dinner, and what do you spend the whole damn time talking about? The kids. It's like, can't we get away from this? But we can't. We can't, because it's so pervasive. It's like the wet blanket over us in everything we do. But talking about it is what helps us to heal. Getting it out, sharing your experience, like having people like so fed up with it like we are, and sharing that this is our common experience goes a long way to avoiding isolation. We may be separate, but we don't have to be isolated. 2 very important distinctions.
Thank you.
So we're on Zoom right now, and I just want to put in a word for Zoom, and for the Wenham Senior Center, because there are 4 exercise classes at 10:30 a.m.
It's great.
on Zoom through the WCOA. Just absolutely excellent yoga and some exercise.
Great.
So I made that a part of my life. So. Jim, I teach a writing class at the Wenham Senior Center, and it used to be once a month in person. Now Jim has invited me to conduct it on Zoom, so we do it every other week now, and we feel so connected with each other. It's like we haven't missed a beat. So I feel like I have connections with people. Some I know already, but new people that I am meeting, and from time to time have reason on Zoom to connect with them. So that's been a lifesaver. It's been a life changer. I can now conduct my own Zoom meeting, and it's no big deal. So I just wanted to do a shout out for what the Wenham COA is doing, also making the calls, and that pen pal program that Jen has initiated, a pen pal program. So I'm connected with a 20-year-old Georgetown student.
How nice.
She probably thinks I'm ancient, and so connections are being fostered and enriched and strengthened during this time. And as Joanne said, we all have one common subject now, and that connects us too, even though it's a bad subject.
Right.
Thank you.
It is a huge connecting point, and it's something
Yeah.
everyone is dealing with. It's everyone's reality.
Yep.
Really, because it's so pervasive, maybe the first time in a long time. So Beth, I know you can't speak, but I want to encourage you to think about your medical and dental and all your healthcare providers. Former practice is indicative of current practice and future practice. So if your office has seemed dirty and they've seemed kind of sloppy and you've never really been impressed with that, well, you know, you have some questions to ask. Beth said that her dentist has always been, you know, scrupulously attentive to hygiene and sterilization. And so she has a high level of confidence going back to the dentist. And everyone who's a reputable practitioner is pulling out all the plugs to make sure that their areas are as risk-free as possible, and their practices. Remember, all dental equipment goes through a sterilization process anyway. So when you sit in the chair and they open up that new kit, every single thing in that little packet is sterile and ready for your treatment. So I have been 3 times, and I couldn't have felt more confident in my experience. I've also been to a doctor's office that I thought was very poorly managed. Again, the mask, you know, you see the masks, they become sort of like chin decorations. Right? You see a lot of this, or if they're really going to go crazy, they put their real chin in it like this, you know, which is ridiculous. It's a neck decoration. It's a choker. So, and feel free to speak up and say, that makes me feel uncomfortable. It's always better when you have to criticize someone rather than to put them on the defense and have them coming up with all kinds of excuses about why they're doing what they're doing to defend themselves, is to say, that makes me uncomfortable. It makes me feel a little bit more vulnerable when you have your nose sticking out of the mask. I've had to do that, and I would say 99% of the time people have done what I've asked and put the mask up. A lot of times people just don't know it. And once you establish this pattern of mask wearing, it's a lot easier to breathe, right? Because your nose isn't covered. So that's going to be your default. Every time you put your mask on, you know, you're going to put it on the same way. So, Scott.
So I've actually had a couple of doctor's appointments recently too, and I can say that they've been very proactive in reaching out to me to ask me questions about my health, but also to let me know what procedures and safety factors they have put in place. So I'm very comfortable and confident before I even go in. So
That's
Beth,
right.
if you have any question at all, I would call ahead and ask them what procedures are in place, what should I expect when I walk in? And if you have any discomfort at all about that, maybe think about rescheduling for another time or going somewhere else. But
She's
asking
very confident.
is a great way to go if they haven't already contacted you, to ask you if you're safe and what you've been doing.
Most places are sending out, and they want 3 days of history. So most places, if you don't have a cell phone, they might call you on your house phone and go through the questionnaire with you. If you're on email, they may send it to you on email. If you're not that much into technology, they're probably going to try to call you on the telephone and ask you, you know, have you been in contact? Have you been with anyone with traveling? Do you have a cough? Do you have a sore throat? You know, have you had any of these symptoms associated with COVID? They're required to do that. All medical practices are following the Department of Public Health guidelines in requiring screening before anybody comes into a dental office. So it's not whether they choose to do it or not, it's mandated by the Department of Public Health. Dawn, we haven't heard from you. I hope this has been helpful for you, and that if we do another one of these, you know, think up your questions. I want to give you an email address that belongs to Aberdeen. It's called Virus, virus, at aberdeena@home.com. And that's at is spelled AT. Virus at the A symbol, aberdeena@home.com. And that comes to our office, and we get emails all the time, and with people that have specific questions that maybe they felt funny asking in a public forum, or came to them as soon as the call was over, or they had a dream about last night, or their cousin Myrtle from North Carolina suggested on a telephone call. So however these questions come to you, you can feel free to send them to us, and we'll do our best to answer them. So Beth and Dawn, thank you for joining. Sorry we didn't get to see your lovely faces. But I've enjoyed being with you. I hope this gives you food for thought, and maybe encouragement, or just another little view of the pie of how we're doing. Jim, you should have seen that hunky guy at the beach who was just on the call. I mean, I'm telling you.
It looks exactly the same to me today.
Wow.
Looks the same to me.
That guy's tough. His dance card is full.
You're not the one I want to hear from, Scott.
Nothing personal.
Thank you so much, Joanne. I always love hearing what you have to say, and it's really, really helpful. And
anytime.
We all appreciate it.
Anytime. Maybe I can get back and see you in the fall. We can wear masks, and we can talk about other things that are relevant besides this damn virus. How about that? That sound like a deal?
I hope it's not what they're talking about in November as being like worse than it was. I mean, so depressing to think about that.
Well, if it is, that will cause us to need to get together like this.
We will.
To stay protected, because we won't have the option of going outside, in the bad weather. So we'll have to come up with more creative ways.
And Jim, how do I find out all the great things you're doing at the COA?
Oh, I just need your, I have your email. So Jen sends out an email on Mondays. So I'll make sure you get that.
I would appreciate it. I'd love to take advantage of some of these things. Thanks.
Yeah.
Hey, Jim, if you want to put that email address in your newsletter, virus@aberdeena@home, I'm happy to have you print that, and people that may not join the call might want to email us.
I'll send that on to you, Jim, along with the recording. So
thank you so much. That's great, because we'll try and put that up on HW Cam if we can, because I think in general, what you've had to say, Joanne, is really helpful for the general public, and so we'll try and make that happen in the next week or so.
Great.
Good. Thank you.
Take care, everybody.
Thank you.
Get to that yoga class, Barry. Have a great day, everybody. Great to see you all.
Thank you. Have a good weekend.
Bye-bye.
Stay safe. Bye.
Bye, everybody.